Hi, I'm Dr. David Hill, and today we're going to talk about how to identify a migraine. Now, identifying migraines is sometimes really obvious and sometimes really tricky. A migraine is what? It's a headache, sure, but there are all sorts of different kinds of headaches. They're not all migraines. Now, a lot of people, ironically, underestimate how many of their headaches are caused by migraines. A lot of people think they have sinus headaches. As a matter of fact, people with acute sinus infections may have headaches, but very few people with chronic recurrent headaches actually have sinus headaches. A sinus headache should hurt in one spot, for example, over one eye or beside one side of the nose. It should be tender when you push on it. It's almost always accompanied by some symptoms of sinus infection: runny nose, stuffy nose, cough, scratchy throat, fever. If you don't have those things, you probably don't have a sinus headache. Migraines tend to recur over time. They come back. When you get one, you think, oh yeah, I've had one of these before. They almost always run in families. We're finding that migraines are a highly hereditary condition. So ask around your family, especially in women in the family. Does your mother, your grandmother, your sister, your aunt get headaches that come and go frequently and make them go to bed for a little while? If they do, chances are they have migraines, and your risk of having migraines is certainly higher. If your headache comes with visual perceptions, if you have blobs, flashing lines, zigzags, outlines of things, parts of your visual field that you can't see, distortions of shape or distance, that's very likely to be a migraine. Now, migraine headaches will often cause nausea and rarely cause vomiting. However, headaches that cause nausea and vomiting also worry us for other reasons. So if that's part of your migraine, I would really encourage you to get checked out. Many people who have migraine headaches notice they feel a little weird before the headache comes on. That is also a type of aura and is strongly suggestive of migraines. Migraine headaches may come on more frequently with changes in the weather or with changes in the menstrual cycle. Those are strong indicators that the headache you're having may be a migraine. Migraines tend to get better when people lie down or go to sleep. Other headaches may or may not. Now, there are some red flags that always worry us as doctors. If your headache is becoming more severe, more frequent, it's not going away in a greater than 24-hour period, it's not responding to the medicines that usually make it better, if it's waking you up in the middle of the night, or if it's the very first thing you feel when you wake up in the morning, those are all very concerning. Headaches that are worse with exertion or worse with moving, like bending down to tie your shoes or pick up something that you've dropped, also worry us. Yes, that could be a migraine, but it could be something else. Headaches accompanied by stiff neck or fever, we obviously worry might be meningitis. All those are great reasons to go see your doctor sooner, not later, and let them get a great history and a great physical exam. Now, very few people with headaches end up needing an MRI or CT scan of the brain. Usually with a good history and physical exam, the doctor can figure out what the headache is without necessarily having to take a picture of your head. That said, in those headaches that have alarming factors associated with them, like the ones I just mentioned, sometimes imaging really is the right thing to do. Talking about how to diagnose a migraine, I'm Dr. David Hill.